Derita, derita, derita. Stop, stop, stop. Okay, okay. Up, 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 up. Don't move. Asparagus.
Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in the video today, I'm going to be discussing another one of my rotations. Like I said in my previous videos, I've completed all of my rotations in PA school. I've also graduated from PA school. So hopefully this video is helpful for you guys. For those of you who are about to start your clinical rotations, don't know what to expect. And then for those of you who are in your didactic year and are about to go into your clinical rotations. So hopefully this video is helpful. So in this video, I'm going to be discussing my nephrology rotation. So I did a rotation in nephrology and I loved it. Real quick, just recap. I did this rotation last year during COVID-19. So we're still currently in the pandemic COVID-19, but last year when COVID-19 was pretty bad. And because of COVID-19, most of the rotations were shortened. We were out of rotations for some months, just because they are programs and they just wanted to make sure that we were safe from coronavirus and not get infected, even though I still got infected with COVID-19. But they just want to make sure that we were safe from COVID-19, so we were out of rotations for a while. And then finally we went back to rotations. So that's why our rotations were shortened. Usually our rotations are about a month long, about 4 to 5 weeks long. And this time they were a lot shorter. But regardless, I was very happy that I came back and was in rotations. So I will be discussing my nephrology rotation in this video. So last year when I completed and started this rotation, I had already taken my PACRET. So your PACRETs are the ones that you take after your didactic year. It's kind of like a PANTS copycat, and it kind of tells you what your weaknesses are and it gives you a score. And then you take one after your clinical rotations, after you completed all your clinical rotations, after you completed all your end of rotations. And in this case, in our case, we had completed all our end of rotation exams. Even if we hadn't completed our clinical rotations, we were going to complete those later because of COVID-19 and since we were out of rotation. So you take your PACRET 2 and it kind of tells you what are your weaknesses. Well, my weakness was nephrology. So I was very happy that I got to do a rotation in nephrology. Nephrology was my internal medicine rotation. So you don't really have to do a rotation in internal medicine. It can be in cardiology or nephrology or anything. So I did my internal medicine rotation in nephrology with a nephrologist who did both like internal hospital medicine and also saw his own nephrology patients. So I thought that was really interesting, and I was really blessed with a doctor that did both clinic and hospital medicine. So I really loved that. One thing I do have to say is that probably this was one of my favorite rotations out of all the rotations I've had. I definitely had 2 top ones, and this was one of the ones that I really, really loved. My preceptor was amazing, so that was probably one of the reasons why. Very smart individual. Nephrologists are just smart in general, and he was just smart and willing to teach, and he loved to teach and is very, very humble. So I really love that rotation because of that. So what was my schedule? So I went in Monday through Friday. I would wake up early. So for example, since he usually started rounding in the hospitals he started at 7, I would meet up with him around 6:30, and then we would start rounding with his patients. Usually sometimes I would be with another nurse practitioner student, but sometimes it would just be me. So it was me and the doctor. We would go and round on his patients. So he had a list of patients that were his patients or patients that were from his clinic because he was part of a nephrology group. So any of the patients that were his own patients or part of the nephrology group, depending if he was on call, we would go and see those patients. And we did this during COVID-19, and it was very sad because I would say that almost all the patients, if not like more than 90% of the patients that were hospitalized in the ICU with COVID-19 had acute renal failure or acute kidney injury, so your AKI. So that's why my nephrologist saw a lot of patients who were really busy during that time. So that was one of the things I thought was really interesting, is that the majority, if not all, patients that are in ICU or in acute critical care because of COVID-19, they have renal failure. And of course, there's multiple causes or reasons why individuals die from COVID-19, from your acute respiratory failure, but also renal failure is one of those. These patients, and it was really, really sad. So we saw a lot of these patients. We were really, really busy during that time because we had a lot of COVID patients in the valley where I complete that rotation where my program is located at. So it was a really sad rotation. I really enjoyed it. I learned a lot, especially for those of you who are not really comfortable with your acid and bases, which I wasn't. I learned a lot during that rotation on metabolic acidosis, how to read your acid and bases imbalances, how to read your ABGs, how to treat hyperkalemia, hypokalemia, how to treat metabolic alkalosis, metabolic acidosis, your diuretics, Bumex versus your other diuretic like furosemide. So it was a great rotation. I learned a lot. So for those of you who want to do hospital medicine, critical care medicine, I really recommend maybe a rotation in nephrology. You are definitely going to learn a lot in regards on how the kidney works. I love the kidneys, and I think that they don't get as much credit as they should. Of course, you know, our heart's really important, our brain's important, but so are our kidneys. Our kidneys filter our entire body, so it's really important that we maintain them healthy, and us as providers get to understand them more. So I really like that rotation, and I was very blessed to be placed in a nephrology rotation. So like I said, we would see patients. A lot of our patients were COVID patients, and the floors were, there were ICU and isolation. He would ask me if I wanted to enter the room with him or not. Of course, if I needed to enter the room, I needed to gown the PPE. Sometimes I would go in, but I had already had COVID-19. I still wanted to be precautious because I lived with one of my roommates that had not had COVID-19. So that was one of my biggest fears, was me coming home with COVID-19 and giving COVID-19 to my classmates. So I was very careful, especially during that rotation. And I also want to thank all the nurses that came down to the Valley, of course, and helped our patient population during COVID-19, during that time where we had a huge spike and we were seeing a lot of deaths everywhere. Because during that rotation, it was interesting. I would go to the hospital and you would see like these huge buses like just lined outside of the hospital. And then I would ask my doctor, I'm like, hey, what are these buses doing? And they're like, oh, those are all the nurses that the government sent. So there's a bunch of nurses here working at the hospital. And yeah, once you went to the floors, you would see those nurses. So I'm really thankful for those nurses who came and helped you know, our patients in the Valley to get better. So very thankful for them. But great rotation. So we would see patients, like I said, from 7, we would finish around 12, take lunch break, and then after that we would go to the clinic and finish the rest of the day in the clinic. So in the clinic, we would just see as patients that he would follow up for. So patients that had like chronic renal failure, patients that have like really bad diabetic nephropathy, patients that have like nephrotic syndrome, nephritic syndrome, etc. So we saw a lot of patients with lupus, especially when it's gone to their kidneys, especially your young like female patients like in their mid-20s that are already going into acute renal failure because of lupus. It's very sad. So I learned a lot definitely of how lupus affects the kidneys. Biopsies, reading your biopsies for the kidneys, whether it tells you if it's something like lupus or something like maybe like Goodpasture syndrome, etc. So it was a great rotation. I really recommend it for those of you who want to do hospital medicine, critical care. You're definitely going to learn a lot about your acid imbalances, hyponatremia, hypernatremia. It was something that I struggled a lot with, and not only me, but also a lot of the residents that I was rotating with during COVID-19 when treating these patients. Like, how do you treat your hypernatremia versus your hyponatremic patients? Especially your big one is your hyponatremia, right? Hyponatremia, hypovolemia, hypervolemia, hyponatremia. So my nephrologist was very thankful, and I was very thankful to him because he taught me how to differentiate between these two. And why is it something that we struggle with a lot as providers, understanding on how to treat hypernatremia and hyponatremia, because we obviously don't want to like over dilute our patients, especially if they're like hypernatremic and cause something like, you know, their brain herniate. So it's something really important to understand. And certain days, like out of the week, we would go and also see the patients that he was in charge of for dialysis. Now I have to say that I think the few times that I did go and do go with him to see the patients with dialysis, I always came out and my eyes were like all teared up, because it's just so sad to go in there and see, you know, all these patients, and some of them are really young, just how diabetes has affected their kidneys, and they're there having to get dialyzed for hours. They show up, the days that we did dialysis, we would show up a lot earlier, so we would be there like around 5 to 5:30, and you know, that's really sad just to see all these patients, young patients, sitting there for like hours getting dialyzed. And not only that, really sad to sometimes, like, we would go and see the patients, I would get really attached to a patient, and then we would go in like the following days back, like probably 2 days later, and then that patient was not there anymore because COVID-19 had taken their life. So it was something that was very heartbreaking, but I think that's why it made me love the rotation more. The reason why, you know, we're doing what we're doing is to treat patients and to educate patients about diabetes, for example. That way they can get it under control and avoid things like dialysis for them getting like chronic renal failure, especially if they're young. So that was something that, you know, has stayed with me, and I thought was very sad. And I like the fact that I felt like we were doing something for our patients, especially for our COVID patients, 19. If they were like in the ICU and we were caring for them, and then you come back like a few days later and the patient's already completely fine. Like, they're a different person. While they were like intubated a few days ago, now they're just talking to you. So I really like that also. I saw a lot of pericarditis. So in those patients that get like uremia, right? Because your kidneys are not working anymore, like you're uremic. I was able to listen to pericarditis for the first time. I always read textbooks about how pericarditis is, you hear that friction rub, right? I was finally able to hear it in these patients. So very grateful for that. So overall, I'll stop talking. It was a great rotation. I really recommend it for those of you who want to do hospital medicine, critical care medicine, or are just struggling in nephrology like I am. I know definitely this rotation helped me a lot for my PANS also. So really recommend nephrology. I love the rotation. Take care of your kidneys, guys. And as always, thanks for watching my videos. If you guys have any comments or suggestions on future topics for me to discuss, comment below, and I'll talk to you guys later. Bye.